Hi, Reto. Welcome to the Value Creation in Life Sciences series. I really appreciate your time. Thank you very much. And I would like to start with a small introduction that you can give to the audience. Thank you.
Hi, Saurabh. Yes, thank you for the opportunity to talk to you. I'm Reto Naef. By training, I'm a chemist, obviously an aged chemist. I worked 35 years for Novartis, was always lucky, had research departments running with up to 400 to 500 people in different indications. My entry to science was actually the discovery of the first immunosuppressive drug, which enabled heart transplantation. I was doing my PhD thesis and already there worked together with the pharma industry.
Perfect. Thanks a lot. I'm sure we'll have an interesting discussion today. My first question, Reto, to you is about serendipity in science. I have brought up this topic with investors as well in the past in the value creation series video. One is that we always believe that when we are working in science, everybody is in white coat, working very seriously, have a very fixed plan for doing something. Now, when I see your pipeline, Tupadur, I see wound healing solutions, but also I see some of the solutions like oncology and PAH and alopecia, for example. So my question to you is that how did these evolution happen? Would you consider that this was a outcome of chance favors the prepared mind kind of?
No, I think it's actually looking back, it was a great journey. I started in 2009 when I still had my full job at Novartis. And kind of back then I had this idea. There was a paper published on sildenafil, kind of the Viagra API, showing that it increased local blood flow and it enabled in some aspects wound healing. Now, wound healing, chronic wounds, that's a big, big problem. And back then I had the idea, let's just make a super potent Viagra in order to give it locally, increase locally the blood flow and enable wound healing, because that was the weakness of sildenafil. It was simply not potent enough. So, we started thinking about I outsourced chemistry, did some experiments in my own cellar, and the beginning was just always linked in, oh, it must be more potent. And suddenly I had this idea, well, kind of in the first indication of sildenafil, we have two components. One is the drug, the other one is the signal which generates locally nitric oxide that comes through the libido. And so I felt, yeah, that's the idea. That's the clue. So that was the first kind of a brilliant idea under the shower. Probably I don't remember where it was. So we just started to do this dual mode of action drugs, which
Right.
in the cell actually release two components. So it's a single molecule in the cell. It's bioactivated, releases two components. One is nitric oxide, and the other one is by now much, much more potent. Sildenafil kind of variant, I would say. We are still more than 1,000-fold more potent.
Correct.
So, that was the first thing. And then, of course, we said, well, insufficient local blood flow, that is actually an aging problem. When we lose our hairs, when we lose our vision, when the chances go up for colon cancer, this all has to do with local insufficiency of blood supply, of microcirculation. And that's how the pipeline was built with different molecules. Because what I didn't tell you is that the bioactivation is specific to certain cells and tissue. So we have two principles: give the compound locally, and we can do that because we increase this efficacy and potency so much that this became enabling. And then last but not least, kind of medical aesthetics or cosmetics, hair loss, this is one thing. Skin aging, our skin gets thinner and thinner when we age. This has to do with nutrient supply to the skin, so the microcirculation. It's kind of, it sounds now logical, but I would say it's absolutely serendipity, because you stumble over a scientific paper, you read
Yeah,
that, right
exactly.
now, Duchenne muscular dystrophy, where we know exactly, we could deal with that. Uh, the problem for a born scientist as me is rather, can we handle serendipity and these brilliant ideas? How many of them can we take up and kind of put the idea through till you have a clinical candidate and prove in patient that it works. So we have done that with one compound so far, with one of the drug candidates, and it works. So of course, the chances go up to also for the rest of this technology platform drug candidates.
Thanks a lot. So I also understand that, to achieve this, you also need to have a kind of flexible and open mind rather than, very rigid and strong process, right? Because without flexibility, it is very difficult to deviate from what you're trying to do.
Saurabh, that's a good point. I think this is the strength of a small company. I've spent more than 30 years with huge global players. Now, they are very well organized. They have their departments. They have their BD&L. The BD&L gets told what's the focus of the company. And of course, they select based on that focus. Serendipity in terms of indications, that's nearly inhibited by these very large companies. Now
Right.
they realize their weakness and they have to develop their own kind of pathway discovery functions. But it's much easier in a small company to follow serendipity. You see
Exactly.
this great thing, you develop it, and then the next day, basically, you can implement that. I don't need to ask 20 people in the 5 layers of hierarchies.
Exactly. Super perfect. No, that's very interesting. So now moving up, what I would like to ask, interesting question regarding one of the biggest challenge of a biotech company, and that is financing. Okay. So till now, I think very successfully you have raised combined equity and grants together around $34 million, right? US dollars. Um, First question related to this is how hard it was when you started it. Okay, and the second is that as you have raised this much money, what are the key success factors related to that?
Well, serendipity probably as well, because you need to run into the right investors, and most of these aspects are probably by chance. Uh, with every kind of equity round, or we did quite a bit of convertible loans where with automatic conversion into shares afterwards. So at beginning, I felt, ooh, that's a very tough goal. And, I was lucky. I ran into the right people. We did win several competitions in Switzerland, in front of huge crowds, and that helped. I have many private investors, and I think here trust building, credibility are the biggest aspects. And you need to develop a personal link to kind of a private investor.
Right.
So yes, it's a lot of talks. If people who don't like to do that, then they consider this as very hard. I always got to know new people, fascinating individuals, and kind of I really have had fun of to explore these opportunities. Now, it's a little bit different if you talk to companies, strategic VCs or VCs. Again, they tend to be less open to new ideas, I would say. the innovation technique. So many of those large organizations have the tendency to follow. Oncology is or biologics are typical
Correct.
examples.
Yeah.
Or in the past it was combinatorial chemistry. You always have these hype movements, and these large organizations kind of follow more kind of a leader. And so
Correct.
I think this is the most difficult thing, to identify a VC who can lead and not just follow in terms of indication, in terms of technology.
Got it. Perfect. I know you have made a very good point, because I think recently also I saw in Twitter, a discussion about how instead of focusing on unmet need, sometimes a lure towards a large market, or let's say focus towards only oncology or certain indication, is actually not creating value to the patients.
Yes,
Right?
yes.
So no, perfect. Thanks a lot on this. So now my last question to you is based on risk. So we do at Farmantra a lot of risk analysis and so on, and risk is one of my favorite subjects as well. So a biotech company faces mainly three risks. One is scientific, one is financial, and one is commercial, right? And they need to manage all these risks well in order to get the reward. Okay. So given this, your history of several years in this business, what do you do, and let's say inside, what internal process you have, or how do you evaluate these kind of risk, and how do you try to manage these kind of risk?
Another good question. It depends. It starts actually with your long-term goal. Do you want to develop one asset, uh, do a trade sales, and then leave the field? Or did you build the company for sustainability, which I tried to do so? So then you have different objectives, different strategies, because I want to balance the risk. I want to, even if one of the products fail, I want the company to survive and kind of develop. So it was from the beginning clear that we need more than one asset.
Right.
And in order to profit having different assets, you have to have synergies between the assets. So
Correct.
that helps a smaller company also to be able to handle more than one asset. And then the asset should be different status. For every development candidate, we have a backup candidate. So, and that helps at least till your phase one. Yeah. So if
Okay.
something happens with toxicology, you quickly need to come up with an alternative dealing with the problem which you discovered in toxicology. Now, the risks, the financial risks go up the further you get in development, in clinical development. And for phase 3 trial, of course, there the risk is biggest. So what we do in order to handle these risks, first of all, we want to partner with
Hmm.
several large companies, and
Correct.
we partner probably at a value where we could still increase the value, but
Hmm.
then 100% of the risk would be on our side. So
Right.
you have to give in sometimes a little bit on value, partner early in order to share the risk.
Correct.
And then in terms of phase 3, that's a big chunk. We decided not to do a phase 3 in a larger indication. That would not be possible for in terms of financial needs which you have, and also development time. So that's too large for us. But what we have is one of our assets which we have in clinical development, enabling wound healing. There's a big indication, diabetic foot ulcer, a huge
Right.
indication. This we need to out-license. So we can't
Right.
do a phase 3, but with the same asset, we shoot for a rare disease indication, also wound healing, digital ulcer in systemic scleroderma patients, where we will be faster. We can profit from partnering with the big indication, and so really kind of limit the risk. The risk is still kind of as it is in pharma.
Absolutely.
Yeah,
Yeah.
and you
Exactly.
need, the first thing is you need to be aware on that risk, and
Correct.
only then you can come up with a strategy to balance the risk and also the value. I mean, value development and risk taking is somehow connected. Yeah.
Exactly. Excellent points, Ritu. I think, and I agree with you that a combination of non-dilutive and dilutive funding is very important, for the value creation, and that non-dilutive funding, you can bring it, of course, either in terms of grants, but most importantly, partnerships give you a lot of
Yes.
leverage on this, right? And you do this, and this also differentiates between, let's say, a value maximizing value or maximizing value per share, for example, in the long run, right? If you see the example of Kite and Juno Therapeutics, this is an excellent example on how you raise money in the beginning, and combine dilutive and non-dilutive. That matters a lot to give shareholders also the highest return. So excellent, Rito. I really appreciate your time, and thank you very, very much for coming here and spending your time with us. And so, for audience, please stay tuned on these value creation videos. We'll have more such interesting videos with CEOs and investors. Thank you very much. Thanks a lot, Rito.
Thank you, Saurabh. It's always a pleasure. Thank you.